and they give
Well,
her the
well,
workup.
I tell you what, let's go through each category one at a time. So in the
Okay.
mechanism of injury, some of the highlights there. So you have the defenses down. Do you have?
Yep, not braced.
Was they hit from behind?
Yep, not braced. Didn't know it was coming.
Okay, so you got defenses down. You got whiplash injury. Was any of the joints locked out, Seamus? Was her head turned?
It's whatever I asked my client. The defense took the depo, didn't ask anything about were you leaning forward, were you turned in the seat, nothing like that.
Did Seamus get this? Is Seamus sitting there?
Yeah, right here.
Well, Seamus, did you get were the joints locked out in your documentation? I can't hear you, Seamus. I can't hear you. I can hear the attorney. I can't hear you.
We'll keep moving, Paul.
Well, if you want to ask me, I can't hear Seamus. So did Seamus give you documentation? So let me add
I'm waiting for his narrative report. I've got his he's got this biometrics showing laxity of the ligaments.
Well, wait a minute. We're kind of all over the place right now. So I take it Seamus is not sitting next to you?
He is. Yes, he is.
How come I can't hear him?
I don't know. Can you hear me now?
Yeah.
Okay.
So Seamus, do we have the joints locked out?
Yes.
Okay, so you have all three injury magnifiers, and then I'm going through the list. So those are the major ones. And then do you have any of the other major? Well, you got another major one. Didn't you say the car actually moved and skidded and hit the car in front of him?
No, our car was pushed forward half a car length from the impact.
Okay.
The negligent driver.
Was the car moving? When she got hit,
stopped.
She was totally stopped. She wasn't rolling.
Totally stopped.
Okay, so that's not helpful there. And then
well, he says, well, wait a minute. The defendant says her car was moving when she got hit.
Okay, well that adds another. Remember, that adds another injury magnifier because remember, if the car stopped, more energy is absorbed due to the having to overcome the coefficient of friction, which means less energy went into the occupant. But it's just the opposite. So if her car was rolling when she got hit, there was very minimal to no coefficient of friction, which means all of the energy, or most of it now, went into the occupant.
Okay.
So you got another injury magnifier there. How about the weight differential in the impact vehicle?
He's in a Jeep. He's in a Nissan. So I think her car is going to be heavier.
So I would go online and see how much of a, and I always say if there's over a 20% weight differential, I'm definitely going to include that as an injury magnifier. If because remember, force is equal to mass times acceleration, so mass is a major component of force. So that would be if that happened. Did she have her headrest all the way up, or was it down halfway, or totally down? Do we know that?
We don't know the placement of it, so we control that evidence. It wasn't asked in the depot.
Okay.
She was seatbelt kid? Yeah.
And remember, seatbelts increase injuries. They save lives, but they increase injuries due to the category of anatomical failure. People go through active, passive, and joint motion much faster into anatomical failure when they're restrained. That's why there's a lot more injuries with seatbelts, but there's a lot less deaths because they're not thrown from the car. And a lot of juries don't realize that. They just think that there's a lot less. They just categorize there's less injuries because seatbelt saves lives, because everybody knows seatbelt saves lives. What saves lives because they're not being thrown from the car. But there's more injuries because of seatbelts. So that's another injury magnifier, and that's due to the anatomical failure category. So,
how do I? Yeah. Okay.
What?
How do I explain the anatomical failure to the jurors? You know, your muscles react at a certain rate, but
Well, Seamus knows how to do that, but what happens is energy is first, in the human being, energy first is absorbed in active range of motion, then it goes through overpressure motion, then it goes into joint motion, and up until this time, there's no anatomical failure. And as soon as it goes past joint motion, now we have anatomical failure. So how many mechanisms, all these, what we call injury magnifiers, how many of them were resisting to get to anatomical failure? Well, as an example, when the defenses are down, there's no resistance, and so more of the energy goes right to the end of joint play into anatomical failure because it's not absorbed. Energy is not, basically the less energy that's absorbed in active, passive, and joint motion, the more the enhancement of the injury because there's more energy at the point of anatomical failure. Now, Seamus knows that. Seamus can explain that to you.
Okay.
So what are the other, let me take a quick look at the other injury magnifiers here real quick.
She had a hitch assembly, so she's got a kind of a hardened, more heavy contact point with her car, which would put more force through the chassis, arguably more force through her neck and low back.
Okay, so we talked about the defenses up, joints locked out, wearing a seatbelt, headrest up. We don't know that. I'll check in the car weight differential. I check into the car safety rating. If she has a lower safety rating, there's less energy absorbed. Was there slick surface conditions? Was it raining? Was it gravel?
No slick. It was kind of dry, straight.
So you got the vehicle moving. You got the foot on the brake. Airbags deployed. Were the airbags deployed?
Yeah, the bullet car is deployed.
The what?
The defendant's car's airbag deployed.
Okay. What's interesting about that is airbags are like seatbelts. They save lives, but they increase. They can increase the injuries due to you're back into the category of anatomical failure. It's much quicker to possibly go into anatomical failure when your body gets restrained. So
he was a young kid. He said he didn't have any injuries from the accident. My client told the officer she wasn't injured, but she went to the emergency room within 40 minutes.
Right.
And that's just a shock. She's got a 2-year-old child in the car.
Well, I'm just going through all the injury magnifiers that help support not only that there was an injury, but it again, it's self-stated that all these things help to magnify an injury. And then when I say magnify, I'm talking about energy absorption. Energy absorption. That's what creates energy. Is with energy transmission and absorption. And the hardness of any material. So there's nothing hard. On the rebound, did she have a rebound effect? And where she slammed back against the headrest or the back of the headrest?
Yeah, her head broke the headrest. The impact shattered the head.
Yeah, that's major right there. Yeah, that's major. So you have a rebound effect, and Seamus should be able to explain to you the rebound effect of a whiplash injury. So you have a rebound effect of a whiplash injury, and it was enough force to destroy the headrest. So that's a pretty significant finding. That's a real significant. I'd want a picture of that to show the jury if I could show a broken headrest.
We're telling her to get it. We can show them in the repair envoys. She didn't get a picture of it. She didn't hire me till her Kaiser doctor said, you need to get a lawyer and you need to treat outside Kaiser and send their medical records.
Yeah.
Of course, they're going to argue that if for the 4 months after the accident, she only went into Kaiser 3 times and they gave her 1 PT and Norcos to deaden the pain. And
yeah, I don't get caught up in that. I stick with my protocols to create the support, because there's a lot of different reasons, why people do whatever they do. So I'm looking to stick with my checklist to increase the
Confirm the end. I like that approach. I go back and forth. I sweat over where the defense is going to attack the case. Okay, but I got you. But when I go,
well, I tell you, one of the things relative to that I pay attention to, and it's real common with patients, is did they not go because they were busy and they had to go to work? Were they afraid of getting fired? Could they not take any time off? See, those things are real life examples of why patients don't go to doctors after an injury. And then the secondary component of that is medications. I can't tell you. They'll go to the doctor, they'll get pain pills and muscle relaxers, so they have the injury, but now it's all been covered up. So if I can use both of those, that they either have pain pills, muscle relaxers, in addition, maybe she had to go to work or she was afraid of being fired. When I use those two combinations, it easily explains why she only got 3 treatments or something like that.
Okay. And the only reason she got PT is she's phoning in and asking for it at Kaiser. But, you know,
one other thing that Seamus has to know is home care. See, a lot of these people, they'll say, well, you only went to the doctor 3 times, trying to minimize it. And I just told you 2 of the areas that I'll pursue aggressively with documentation. The third one is home care. Did the patient restrict or limit their ADLs at home? Did they, 3 things I'm going to look at. Did they restrict or limit their activities of daily living at home and life? Did they use ice packs or things like that? And did they take over-the-counter medication like aspirin and ibuprofen? See, those are home care, and I not only want to know them, but I want to know the frequency, because that is exactly like just like going to a doctor 3 times a week.
Yeah.
So, home care is a major undervalued. It's not looked at as strong enough to go, wait a minute. She's taking aspirin, she's taking ibuprofen, she's restricting her activities of daily living, and she's using an ice pack. Well, she's applying self-care, which is no different than if she went to the doctor.
I like that.
So I'm going to pay a lot of attention to, like I said, home care and the frequency, and then also the medications and ADLs. And that's going to help counter the argument, well, she only went to the doctor twice or something, whatever.
Yeah, it's, their orthopedic surgeon looks at that fact. She went to the doctor within 40 minutes. She only says thoracic pain and her knee is injured. She's got some bruising from the seat belt. So they take an x-ray of the knee. They give her an injection, muscle relaxer, this Ketorolac injection. They give her Norco. She comes back 3 days later. Now she has neck and low back pain. So it's kind of 3 days delayed. And then she comes back 2 months later. She's got the low back pain, but she's got OBGYN issues.
See, I'm going to use that against them. The thing that they're going to try to use against me, I'm going to flip it, and I'm going to use it against them because it's their pain pills and muscle relaxers and, all those medications that decrease her urgency for care.
Yeah.
I'm going to use that against them. So,
like that.
When I go through the injury magnifiers, so she's got, you got several. You got defenses up, joints locked out, whiplash, seatbelt, headrest, maybe car weight differential, vehicle moving, rebound effect. You got 8 injury magnifiers. You got a good head start.
Yeah.
So now let me go to the next category. So now we're just going to go into all the findings. So we go, okay, what are all the subjective findings? So we go, okay, list all the subjective findings, including signs. Was there any, antalgia, grimacing, bruises, things like that? So we got signs.
They say that, the first 2 office visits. They give her the injection. They give her Norco first office visit. They keep refilling it every month for 4 months at Kaiser. She's gone to her the urgent care, her physician, total of 4 times, including the physical therapy. Okay.
They're just hurting the case. They're hurting the case. They're helping you by doing that, but they're hurting the patient.
Yeah.
They're hurting the patient in 2 ways. One is they're decreasing her defense mechanisms. Her defense mechanisms are paying to prevent her from continuing and exacerbating the injury. And so that's what happens when these people are on all these pain pills and muscle relaxers. So they're more prone to re-injuring activity and delayed treatment response. But also many of these factors, especially NSAIDs, inhibit collagen synthesis, which is important in the healing process and creates a permanent weakness. So I use these things against them. But let's go to the second. So we talked about subjective. Now we go to, wait a minute.
If I was a defense attorney, I would say that they say she's in mild distress, mild muscle spasms, okay? But she's juiced up, like you say, on Norco and everything. So then they tell her she needs to be treated 2 or 3 times a week. They can only see her once every 3 weeks for the next 12 weeks. So there's a prognosis, future treatment plan. They put in the medical records, you need to go outside of Kaiser to get the modalities for the treatment. All we have is heat. You put your fingers up and down the wall and you roll around on a rubber ball. Basically, that's all they have. And her treating doctor said she was healthy before the accident and that they always send their patients out for acupuncture, chiropractor. And it's very normal because you get other modalities that they don't offer at Kaiser. So she goes out, she chooses some chiropractor before she hired me, and I guess the reputable and everything. She's got the pain scales, she's 6 out of 10 pain scale. That's subjective. I want to use that. And she goes through about 3 months, about 32 chiropractic, traction adjustments, some massage, ultrasound, muscle stimulation. She doesn't get any better, respond to the course of chiropractic, so they refer her to an orthopedic surgeon. He refers her out for an MRI before he meets with her. The MRI shows a 4-millimeter disc protrusion, we'll call it a herniation, severe foraminal stenosis at L4 on a 39-year-old woman with no history of trauma or other auto accidents. He looks at her and...
Wait a minute. We're kind of going all over the place right now. So
okay.
remember, I'm at my subjective, so I'm nailing all those. Then I'm going to my hybrid findings, and the most common hybrid findings with ranges of motion are overpressure, and she's probably got some active range of motion issues, but definitely overpressure. And then you go to a muscle testing. She may have some weakness that are hybrid findings. Nerve testing, she may have, but probably not. And then orthopedic tests, she's definitely going to have joint overpressure findings, whether it's CAMS, foraminal compression, range of motion extension. So those are going to be the hybrid findings that you most likely have. Seamus, does she have those findings?
Yeah.
Okay, so we got mechanism of injury, we got subjective, we got hybrid findings in all those categories. Now we go to the objective findings. Seamus, does she have ALMSI?
Yeah.
So we've got the number one soft tissue spinal injury. That's spinal instability. So she has alteration of motion segment integrity. So we quantified that. So that's measuring the joint motion. That's totally objective, and that's science-based. Those are motion x-rays and lines of mensuration. Those are standard medical protocols. So we have, and that's a 25% impairment rating right out of the block. So we have totally subjective, totally hybrid that reinforces the mechanism of injury, and we have totally objective. We got 3 major categories to support this mechanism of injury. So now we get into therapeutic protocol, and the only thing that I'm going to pay attention, or the major things I'm going to pay attention with what they do elsewhere. I don't care what they do elsewhere if it doesn't fall into the 3 phases of healing relative to the patient's biomarkers. And medicine typically doesn't. It's typically medicine for all 3 phases. So like I said, what I'm going to be paying attention to is how those medications created false negatives. So they either created negative findings, lowered positive findings. and allowed her to re-injure herself and do activities that her natural defense mechanisms were subverted through analgesics and pain pills. So now I'm going to go, okay, what is the therapeutic protocol that was used for the inflammatory phase? And all of those are fine in the inflammatory phase, but not through all three phases of treatment. And that creates credibility when Seamus says that. So yeah, that's totally okay for the first 2 or 3 or 4 days, but not for the repair phase of healing, and that's exactly what happened. And Seamus can explain the difference between the inflammation phase, the repair phase, and the model phase, and what therapeutic protocols you use and why. And then especially in the therapeutic protocol of physical medicine that's required in the repair phase of. Seamus can explain that. He can explain neurosensitivity, the nerves being trapped by collagen. He can explain collagen elasticity and strength, and all of those are supported by the biomarkers. And also those were not done. Those therapeutic protocols were not done by what you just said outside of, I don't know what Seamus did, but outside of, the typical medical care. So you got great therapeutic protocol to support what you're doing and the reasoning behind it and why they did the wrong thing and it hurt her. That's how I'm attacking this. They did the right thing for 2 or 3 or 4 days. Giving medication for, the inflammation phase for 2, 3, 4, 5 days is okay, but not for the whole treatment through all 3 phases of healing. There's different protocols for every phase of healing. Seamus can tell you this, and this needs to be brought out.
Okay.
So I'm going to use that against them. Not only did all those medications inhibit her and create possible reexacerbations and lower the positive findings, but it was the wrong therapeutic protocol in the repair phase of healing and the remodel phase of healing. And so there's my therapeutic protocol. We've got it quantified. And then from there, I'm going to go into MMI. Sounds like she's going to go right into MMI because of how long it's been. And we're going to define that based on the AMA guides and the science of the 3 phases of healing. So we have a maximum medical improvement, and we have an impairment rating. And you got everything supported right here. This thing is being projected for a policy limit. This thing should be blasted out of the park. And so you've got...
I told, because they have 2 hired guns that they use all the time, the offer is only $4,000, if you can believe that. Policy limit commander.
That's
yeah.
ridiculous.
It's a political fight. We're in the Inland Empire. It's a region.
Yeah, but no, it's not. It's everywhere. That's everywhere. It's not where you're at. It's everywhere. But here's the point. Everything I just told you, none of those medical doctors are going to be able to hang with. They cannot. First of all, they didn't do the sensitivity testing and the biomechanics and the joint motion that Seamus did. That's not what they're good at. They're good at fractures and dislocations. They're not good at soft tissue and biomechanics. Number 2 is they don't know the therapeutic protocol based on the science of the 3 phases of healing, especially the repair phase. Now, Seamus, you need to talk with your attorney, make sure he understands this. That the average medical doctor doesn't even know this, so they're medicating them through the repair phase, and it's the worst thing you can do. The worst thing you can do when you understand the physiology of the 3 phases of healing, especially the repair phase. So here they are medicating her when she needs physical medicine and active, passive, and joint motion. It's the worst thing that she could do, and they're assisting in the permanency of this injury by that therapeutic protocol. Seamus, you need to explain this to your attorney.
Yeah.
So
I'm generally aware of it, so we'll be a good team. We'll get that dialed in.
These are doctor, these aren't legal things. These are doctor things. You wouldn't expect an attorney to know this stuff, like I couldn't tell you how to write a brief, So, man, this thing is looking really good. And so you've got you got every category in multiple layers. You got primary and secondary evidence in all 3 categories. It takes you to MMI, takes you to the impairment rating, and then, of course, the need for future care. And Seamus explained that to your attorney, that it's not a pie in the sky. It's based on the clinical findings of that patient for the last 2 re-exams that determined MMI. So it's totally personal to that patient. It's not a guess. Okay, there you are. And now I'm just going into worrying. That supported the whole case, but my God, you got a lot of good evidence, and I'm sure you got the functional capacity indexes to support all this. And then Seamus, make sure when you do the loss of enjoyment of lifetime activities or duties under rest, you have to include those three categories. Number one, did they modify or restrict any of their ADL behaviors, and have they forgotten they've restricted them? Number two, we already talked about the importance of medication relative to ADLs. And then number three, you have to go into overpressure. You got to ask her about overpressure questions in each one of those activities of daily living, not active range of motion. And that's where you're going to find your findings. And that's where you're going to be able to explain why it's painful based on the three phases of healing, why it's painful when it's restricted. And then, so you got your functional indexes, impairment indexes, the functional capacity indexes to support it. Then you'll have your impairment indexes to support it. Man, you're sitting really good. And so you go to the defense of it. You go, okay, the first defense is pre-existing. Was there a pre-existing injury? Did she have any pre-existing injury that was specifically the same?
2 years before the accident, she was sitting in a chair. She fell through it. She's about 5'4", 200 pounds. And in the medical records, for about 3 months, she had low back pain, a bruise on her fanny.
In the last 12 months, from the new injury, going 12 months, only 12 months, did she have any signs or symptoms of the exact injury?
No.
Then 2 years ago is totally irrelevant based on the science of the three phases of healing. It's outside of 12 months. Okay. Totally irrelevant. So that totally eliminates that particular pre-existing injury. So you're good there. Then you go to
the treating doctor. I took his deposition. Been her family doctor for 10 years. Said she was healthy before the incident. So that's gonna.
She was by definition. Yeah. By definition of the three phases of healing, she had no signs or symptoms 12 months prior to the injury. That means it's totally irrelevant to this case. By definition. Okay, so that takes care of pre-existing. Then you go to low impact. We already talked about the injury magnifiers to nullify the low impact injury. You're sitting really good there. You got 8, and then go into the do you have subjective, hybrid, and totally objective findings? Yes, you got all of them, and you have multiple in the categories, and then so then you go into. Then you go into medical team. The only thing I'm worried about now is did Seamus do anything diagnostically that's not science-based, like thermography, surface EMG, neurocolometer? In other words, now I'm worried that was there some fake science mixed in? See, this is where fake science really messes up cases. You got this great case, and then somebody's doing a neurocolometer or surface EMG or thermography. Now they just took this great case and just put this huge shadow of doubt on it by doing a non-scientific diagnostic protocol. So I'm hoping that did not happen.
Two things. They have not subpoenaed his records. They have not taken his deposition. There's no narrative report yet that I've obtained. So, if he did anything out in the fringe area, he can focus on the more medically accepted protocols.
Well, I think from what I know of Seamus, I don't think he's doing any of that, but that would be my next big concern in court.
Okay.
And then, and remember, 88 out of 10 attorneys won't even know to attack that. They won't know that surface EMG is not medically, based. They won't even know it. But anyway, I don't even want to get in, So there's your 4 categories of defense, and man, look how pretty you're sitting after we walk through all those categories.
Yeah.
This is a good case.
I told Seamus this is the one to make a stand. Now we give the recipe to all the plaintiff lawyers to fight the hired guns, to fight the junk science on the defense side.
I just walked through the whole case.
Yeah.
I just walked through how to put this whole case together and defend it.
Yep.
Seamus, are you
Now,
there?
yeah.
Yes.
Do you got everything that we talked about? Okay. And Seamus can explain to you, some of these things, medical.
The healing, the remodeling phase. I've listened to Seamus' seminar and everything, and it's something I didn't really absorb. So we'll go through that. And the impairment, that's something, the MMI, I'll go through that. That's where I got to get a refresher. Everything else is straightforward.
Seamus should just get you up to speed on that. But here's the deal. If that's why these pre-trial conferences are so important, is to educate the attorney the importance of each of these categories, to ask these questions, so me, the doctor, can build and support and put this whole case together and defend it for you.
Yeah.
And by the way, the patient deserves it. $4,000 for that kind of injury is ridiculous.
Nobody will argue that insurance companies are fair. When you look at two experts that have been testifying to the same attorney multiple times for 25 years, they don't fight fair. It's not about truth and justice.
Right. Yeah, I'm
so,
aware of that, yeah.
So that's why we are doing this pre-trial conference. And Seamus and I talked a month ago. I start way in advance because it's common sense to the jurors. They are eighth graders, and I love your model that you use and the way you come in after you establish great credibility, go through the preemptive strikes, no surgeries, no injections. It just shows that chiropractors have a very important function in our society, and everybody will realize that when they go to a doctor, they don't get ultrasound, they don't get muscle stimulation, they're just getting pills or sent to a surgeon. And even if
you got all the categories to win. You got mechanism of injury, subjective, hybrid findings, totally objective findings, MMI, impairment rating. You got all 5 categories to support this case, and then you just make sure you got the categories to defend it: low impact injury, injury magnifier, objective, and science based. This is a total take it to case, go for policy limit case right here.
Well, the policy limit, we want to go beyond that. We want to come up, it's just, I got to listen to Seamus. He referred my client to a pain management specialist. She got an injection. I should have told you that. She got an epidural injection in her low back. She needs one in her neck. And he's an orthopedist, and his deposition is tomorrow. So that may change the MMI. They'll just add more objective evidence. And we had the prior orthopedist within 6 months of the accident saying she needed an injection and maybe surgery because she's got foraminal stenosis and a herniated disc. And now Seamus can add to that the laxity of the ligament at L4.
Well, here's the deal. Not only does she have the permanent injury need for future care, but she has the precursor to osteoarthritis, the #1 disability in the United States, and Seamus can explain this. That is what creates altered biomechanics, spinal biomechanics, the exact injury she has. Not only does it cause pain and restrictions, which affect her in all areas of her life, but that is the #1. It's the precursor to osteoarthritis, altered biomechanics, which creates arthritis, and dependent on her age, there's a high likelihood she's going to need surgery. The younger she is, the more wear and tear she's going to experience, where eventually she's going to need a joint replacement or some type of spurs. She's going to have surgery for spurs, degenerative disc, depending on her age. If she's older, she may live through symptom care, but if she's under, say, 50 or 40, then there's a real high likelihood 15, 20 years from now she's going to require surgery because of the degenerative process that we know how to explain. And that's all part of the protocol.
Paul, what should I ask this orthopedist? She's a hired gun. It's the 3 monkeys. It's just doesn't want to answer anything. It's basically soft tissue should have healed in 4 months. See 2 doctors. It's ludicrous. She looks at the MRI and says because it says desiccation for a 39-year-old that it's degenerative. That's arthritis.
Well, it's an interesting question you just said. how can you destroy the defense witness?
Yeah.
And it's the exact formula, but asking it in the opposite, because they won't have major pieces of what we just covered. They won't even know some of these major pieces we covered. It's literally taking this whole thing and turning it 180 and going at them directly. Did you document it? Did you know it? Were you aware of it? And it's going to be unbelievable how stupid you're going to make her look.
Yeah. Yeah.
I'm gonna wear her down in every one of these subjects, because guess what? She doesn't know more than half of them, and she didn't do them or document them. And I'm gonna get her to say it. That's how I'm gonna.
Well, I've got her. She never even saw my client. She just did a medical report. Okay, I gave it to Seamus a month ago. And it's soft tissue, one time to the doctor, one chiropractic treatment. If you can believe that, with all the subjective evidence.
I'm telling you, I would take this outline, and that's my interrogation to her. But I'm flipping it. You know what I mean when I say flipping it?
Give me that. You gave me that verbiage. I didn't write it down. Did you know it? Did you document it? Give me that again.
Well, what I'm going to do is take this whole sequence that we covered on how to build the case, where we just talked about how to build it and support it. I'm going to take it and I'm going to flip it around, and I'm going to interrogate her step by step through each one of those questions, because over half of this she doesn't know or have an answer to.
Okay.
As an example, let me give you a simple example. You've got 8 injury magnifiers. I guarantee she doesn't even know what an injury magnifier is. She's not even going to be able to explain the difference of, if the joints were locked out, how it relates to the 3 ranges of motion. She's not even going to know the 3 ranges of motion: active, passive, and joint motion. I'm telling you, she will not even know joint motion. Probably won't even know overpressure. They don't test stuff like that. They pay attention to active range of motion. I'm going to bury her. I'm going to bury her.
We got a lot of work to do.
I'm going to bury her with the details of this whole thing in reverse. So how I'm using it with Seamus to support the case, I'm going to turn around and I'm going to ask all those to her. And was she aware of it? What did she find? What was her results? You know what I'm saying? She is not going to know over 50% of this information. And I tell you, even if she does know it, like the 3 phases of healing, she won't even know the 3 phases of healing and the effects of the repair phase. But if she does, that's even going to help you more, because how is she going to respond to increased nerve sensitivity, nerve entrapment by the collagen, decreased type 3 collagen elasticity and strength? She doesn't know any of that. And if she does, the only response to it is, did you do the biomarkers to find it? You think she did sensitivity biomarkers to find that, Seamus? Medical people don't do that, Seamus. I'm going to destroy her. I'm going to make her look stupid. I'm not even going to fool with her credentials too much, that she's a big whoopie-doopie, all that. I'm not even going to fool with that. I'm going to personalize it to this case and this patient.
That's right.
And how much she doesn't know and didn't do.
Yep.
That's how I'm gonna railroad her.
I like that. How much she doesn't know and didn't do.
Yes, that's the testimony that the attorney wants to take her out.
She never did a orthopedic exam, never took a history, nothing. She's got to rely on all the treating doctors, and you can't pick and choose which treating doctor you're going to rely on, doctor.
Now, here's what should happen. Seamus should go through a whole checklist, make it a checklist. And he should go through with you each of it, all the things you have. And then you walk through that checklist of all these categories I just talked about, and you just nail her with each one of them. Did you do it? Do you know what it is? What was the response? And you're going to make her look like a fool.
Did you do it? Do you know what it is? Okay. All right, we're going to bury her. Looks like I'm going to have to take Seamus to lunch, have a long lunch conference, get all what exhibits should Seamus use in front of the jury? You know, we've got 3 objective injuries: laxity of the joint, disc herniation, pinched nerve.
Well, you got all the diagnostic protocols. You just want to get them as visual as possible. You know, I want all those things to be visual and blown up in the posters for the jury. I'm gonna, you know, the CRMA report, the disc, the 3 phases of healing, you know, all those anatomical, you know, the chart for the impairment rating, the physician function, MMI, you know, I'm just, all of these things I'm gonna just put into a poster board so it's visually, and, you know, I'm gonna show, every time I cover it, I'm gonna be showing, you know, the importance of visual to a jury.
They're very visual. They're 8th graders. You're just
Right.
talking, they don't follow. You got to always have something that you're looking at.
And by the way, these are, you know, if I'm a personal injury attorney, I'm just having, these are standard posters that I'm having. And then I will personalize their information, like their disc, I'll copy that and blow it up, their CRMA report, their motion x-ray, you know, I'll blow up their things and put them into a poster board.
Okay.
But man, this case is, this, you should just like beat them over the head and walk away with the money on this one. This.
Well, I'm glad we're hearing this.
They don't have anything. They don't have anything.
Well, they do. They bring in a orthopedist that just says this is just a lot of nothing. It's just.
Well, when I say they don't have anything, what I mean is all of these specific lines of questioning that I have, when they're directed, it just takes them out of the game. See, that's why I told Seamus, I said, that's why we don't compete with like if the nerve injury or the disc injury per se, but when it's a soft tissue injury, this is the documentation and there is no competition. Orthopedist, no. Neurosurgeon, no. But at the same token, I keep saying this, you're not going to be able, Seamus will not be able to beat a neurosurgeon on neurosurgery.
That's right.
But they don't know the soft tissue injury game. See, that's the difference.
True. That's right.
That's what I keep telling my chiropractors. I say, you don't understand.
Well, you got it. Well, we're going to arm all the plaintiff lawyers with the model of how to go about it. Because if you don't make your chiropractor look like an expert on soft tissue, credentialed and credible, you get blown out as against an orthopedist. And if it's a soft tissue case, you can't, you know, bring in an orthopedist, radiologist, chiropractor. It just doesn't work out financially, you know. So
well, you got three. You got all categories. Well, you got mechanism of injury, subjective, hybrid, and totally objective. But you have sensitivity testing in every one of those categories. You got them all. Medicine doesn't do that. Medicine does not. Have Seamus explain the difference between low and high sensitivity testing.
Okay, because
I'm not. I'll tell you what. If you want to do is let me know. I'll kind of help support you with the case. If you want to do another webinar where we kind of just walk through how you would attack their expert witness. If you want to do that, I'll be glad to walk with you.
I would love to do that. You know.
Yeah. So just set that up with Seamus. I'm gonna be set that up with Seamus, but I'll walk through with you how we could literally go after the expert witness and take them out.
If you want, I could email just some basic, you know, just 3 narrative reports, Seamus, Ayao, and Hess, if you wanted to look at it, or.
Well, coordinate through Seamus.
Okay.
Yeah.
Paul, thank you so much for your time. It's awesome. It's enlightening. Gives me a lot of confidence. You know, you hate going into court and the other attorney doesn't do anything. They just say, you know, what are your qualifications? What's your opinion in this case? Soft tissue should have healed in 3 months.
Right.
I mean, she's not doing a conference like I am, writing 20 pages of notes. They just cheat. They bring in hired guns, and it's very disconcerting.
You got a good case. You can put it all together, and you can destroy their expert witness.
I'm gonna love it.
Yeah,
I'm gonna love it.
This is a very good case.
I'm looking forward to it. And they have 2 hired guns, and with Seamus, the treating doctor saying that, you know, good person, you know, significant injury and everything else. I mean, we got everything. We got a high speed. I mean, could you imagine if this was a 10-mile-an-hour impact and the other car, the airbag didn't deploy and they only had like minor damage, but everything was the same, but biomechanically you didn't have the visual? It'd be a very tough case to try.
Well, I teach how to document those and win. That's what I teach.
Yeah. But yeah, okay. I feel like this is gonna be a great case for us.
Well, coordinate with Seamus and we'll catch back up with you, okay?
Okay, we'll give it, the case is set for trial next week, Tuesday.
Oh,
So
that's not good. I'm leaving for Africa tomorrow.
I think I have enough. I'm gonna work with Seamus. We'll get it together. And I think you're right. He needs to do a narrative report because it goes into the jury when they deliberate.
Yeah, his narrative report is exactly what I just covered. That's what's going to be in Seamus's narrative report.
Okay.
It's all the data and the whole sequence I just covered. That's the narrative report.
Yeah, you could just have a report mechanism of an injury subject fiber. We could go right through it, put it right up on you. I have a question just with the paper there. That's
Seamus,
beautiful.
Yeah, Seamus, if you want to give me a call before I leave, I actually leave Wednesday. Today's Tuesday. Yeah, I leave tomorrow. If you want to give me a call later, but man, I tell you what, I'd really love to put the line of questioning together for the expert witness to take them down. This is not going to be hard to make them look silly. They won't know half of every one of these things that we cover. They will not know it.
It's beautiful. Because this is a regional law firm and it affects the value for everybody. Okay.
Now, Seamus, you know this. You know all these things. See, everything we covered, Seamus knows. So, Seamus, talk with your attorney there. You know that all you got to do is help your attorney flip this line of questioning and checklist, but have your attorney ask it appropriately, and then go right through these checklists. You already know how much that medical doctor is not going to know, will not have tested, will not know in all of these, in over 50% of these categories we just covered.
Yep.
And it's going to make them look stupid. All right, let me leave it like that. You guys have a great day. Seamus, if you want to give me a call a little later today, that's fine, okay?
Okay, I'll talk to you in a while, Paul. Thank you.
Okay, take care.